In this video, we will be discussing the process for how to move patients around on dynamic view. In order to do this, the power chart application would need to be open. We would need to select the view button along the main toolbar and then scroll down to dynamic view. Once the dynamic view is open, you'll have this visual. So along the top, we can see the various surgical areas which have been broken down into individual tabs. Once we've selected the appropriate surgical area, we can see within the tab each of the locations within that area. So we can see from main theatre 3 down to 23, for example. We can see any of the cases within each surgical area. We also have along the top the date and time that we can navigate to, or we can utilise the left or right arrow buttons to navigate along the timeline to earlier or later in the day. Down at the bottom right hand side, we have the milestones key. So we can see that if we can see a number 1 in green, it dictates that the patient's in theatre. Number 2 in red is for the surgery start. Number 3 in blue is surgery start. And number 4 in white is when the patient's out of theatre. So for example, on this case, we can see that the duration changed. We can see that the status was last out of theatre. We can see that in green is the duration that the patient was in theatre, in red is the duration that the surgery had started, and in blue is the duration of the surgery stop. And then white we can slightly see on the end for out of theatre. So for each case, you will be able to see the patient's initials, the age of the patient, the gender, if any allergies are known, the lead consultant for the case. If we navigate to today and we scroll along, we can also see that there is a yellow bar and timestamp, and this just dictates the time that it is currently. So in our theatres today, we can see that we have one case in main theatre 6, which has been scheduled but has not started. And we can see there are a few cases in main theatre 7 that have been moved to later than scheduled. So if we wanted to move one of the cases in main theatre 7 to main theatre 6, we would simply drag and drop. We can see there is a timestamp, and that just tells us what time we're going to move it into. We also get a confirm move window that appears, and it's just asking us, are we sure we want to move this patient from main theatre 7 to main theatre 6 from 2:30 to 1:40. We also have various options. We can move this case only. We can move the case and bump the subsequent to follow cases in main theatre 7 earlier, or bump subsequent to follow cases in main theatre 6 later. So we're going to move the case and move the subsequent to follow cases in main theatre 7 earlier. And we are going to select OK. We can now see that this patient has moved to main theatre 6 with a status of room changed. And we can see that the patients that were scheduled to start later have been moved forward. If we wanted to move this last case in main theatre 7 to in front of the case starting at 2:30, we again would drag and drop. Again, a confirm move window will open, asking us if we want to move it from 3:35 to 1:25 within the same theatre. And we can see there are different options for this move. So we can move the case only, move case and all subsequent to follow cases, reorder the cases within the room, or insert this case and bump subsequent to follow cases. So if we say move this case only and say OK, this patient now moves from after the case to before, and we can see that the status has changed to earlier than scheduled.